Hello, I'm Dr. Edward Archer, a research fellow at the Arnold School of Public Health at the University of South Carolina. Today, I'm here to discuss my new paper, Maternal Inactivity, 45-Year Trends in Mothers' Use of Time. This paper will appear in an upcoming issue of the prestigious journal Mayo Clinic Proceedings. Before I begin, I'd like to congratulate and thank my co-authors, whose contributions to this project were invaluable. Over the past 50 years, there have been dramatic declines in physical activity across all domains of public life and private life, from the workplace to the home. Modern humans now find themselves in an environment explicitly engineered to reduce manual labor, increase physical comfort, and afford passive entertainment. Concomitant with these changes were increases in obesity and many chronic non-communicable diseases, such as type 2 diabetes. Given that physical activity is an absolute prerequisite for health and wellness, it is not surprising that it is now a leading cause of mortality and morbidity in the world. The present study is a follow-up to two very influential papers. One in 2011 that demonstrated significant declines in occupational physical activity and occupational physical activity energy expenditure, with men expending roughly 140 calories less in the workplace each day than they did in the 1950s and 60s. Now, with mathematical modeling, they were able to demonstrate that the obesity epidemic, the rise in the prevalence of obesity in Americans, could be explained through this 140 calorie per day decrease in occupational energy expenditure. But unfortunately, it didn't explain it in women as well. So I posited that in the 1950s and 60s, women spent more time in the home than they did at the workplace. So we examined household management. Now, household management was the sum of cooking and cleaning, laundry, food preparation, and post-meal cleanup. And we also included exercise. And what we found was non-employed women decreased their physical activity in the home by over 16 hours per week. That's more than 2 hours per day. And nearly 7 hours per week in employed women. So employed women were working or spending about 1 hour less of activity in the home each day. A concomitant with that was a dramatic increase in their sedentary behavior. Both non-employed women and employed women increased their sedentary behavior. They've doubled the amount of time they were watching television and sitting in front of a computer. And this led to dramatic declines in physical activity energy expenditure, with non-employed women expending about 360 calories less per day, and employed women expending about 132 kilocalories per day. Now, I doubt anyone thinks that we're eating 360 calories less per day, or that non-employed women were eating 360 calories less per day, but that's what they would need to do to make up for the decrement in physical activity. One of the major criticisms of this paper was that we did not include childcare, and this is true. So my colleagues and I went back to the data set, and by using this nationally representative data set, we examined all forms of physical activity, exercise, household management, and childcare, as well as sedentary behaviors, such as sitting in front of a television, non-occupational use of a computer, and sitting in a vehicle. And we measured these outcomes in two groups of mothers, those with younger children, so mothers with younger children from the infancy to 5 years of age, and mothers with older children from 5 years of age to 18. And what we found was from 1965 to 2010, a significant reallocation of time by mothers from physically active behaviors, such as housework and childcare, to sedentary behaviors, such as watching TV or sitting in front of a computer on Facebook. Mothers with younger children decreased their physical activity by almost 14 hours per week. That's 2 hours per day. That's a tremendous decline in physical activity. Mothers with older children decreased their physical activity by just over 11 hours per week. That's over an hour and a half per day. And both groups increased their sedentary time by over an hour per day, over 7 hours per week, of more time of sitting in front of a TV, sitting in front of a computer, as well as drive time and commute time. This was a reallocation of over 3 hours per day from active behaviors to sedentary behaviors. And this led to a dramatic decline in energy expenditure. Mothers with younger children were expending 225 calories less per day in 2010 than they were in the 1960s. And mothers with older children were expending about 177 calories less per day in 2010 than they were in the 1960s. And once again, I don't think that we're actually eating that much less. And that's what we would need to do to compensate for the decreases in physical activity energy expenditure. Now, there are a number of limitations to this study, the greatest one being self-report. Self-report has many problems. There's the cognitive demand of remembering how you spent your day. Did you actually spend 10 minutes watching television or 20 minutes? It's difficult. But one of the things that we found was with objective measurements of TV viewing over the same period of time, we find that our estimates are actually a little bit low. The average American today spends 4.5 hours watching television per day. So our estimates are somewhat conservative. The trend of the reallocation of time from active behaviors to sedentary behaviors has obvious and significant health consequences for both the current and future generations. Given the essential role of physical activity for health and the potential for the intergenerational transmission of obesity as well as obesogenic behaviors such as TV watching or excessive computer use, maternal inactivity may be an important target for the primary prevention of chronic non-communicable diseases such as diabetes as well as obesity. When a woman is pregnant and inactive, she increases the risk that her unborn child will be born predisposed to obesity and chronic non-communicable diseases such as diabetes and obesity. Ultimately, the take-home message is that the hand that rocks the cradle rules the health of the next generation. If we are to improve our future for ourselves, for our loved ones, for our children, both men and women, and especially women that plan on becoming pregnant, need to be more physically active because it is the activity that allows us to remain healthy. Thank you for listening. Thank you for your time.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.